Welcome back to Unpack, where we unpack what hurts so we can heal what's hidden, providing a safe space for men of color to be heard and seen. I'm MTS. I'm not a doctor, as you all know, but I am a patient. Today's conversation matters because too many African American men are suffering in silence, like myself, and nobody is asking the right questions. But today we're going to try and change that. Today, I want to go ahead and welcome our first guest on the Unpack podcast. Let me welcome Dr. Latreece Dickerson-White, a licensed clinical psychologist in the state of Illinois and Indiana. I don't know if you all know, but I live in the DFW area now, but I am a West Side, Illinois boy, so I'm originally from there. Dr. Latreece, thank you for joining us today. Can you share a little bit about yourself?
Thank you. Thank you once again, MTS, for inviting me on your platform. Where can I start? Well, I've been in this field for 34 years. Cannot believe 34 years. When I first started, people would say they were in the field for 17 years. And I could not believe someone had existed that long or just last that long in a career helping people because it's a lot that comes with that. But I do love what I do. I love helping others. So when I first started off, I thought I was going to become an attorney. And I quickly realized that I did not like political science. And I couldn't think outside that box with political science. So I said, what else do you enjoy doing? I said, I enjoy working with people. So that led me to the role of social work. And I got my bachelor's and my master's degree in social work and became a licensed clinical social worker. Well, while working with child welfare, working with the school system, working with the hospital setting, I quickly realized how individuals, especially African Americans, and especially African American boys and men, were being misdiagnosed. And so that led me to return to school and get my doctorate in psychology and become a licensed clinical psychologist where I could put more power behind the pen to make a difference and give the resources and lead them to the right professionals. So,
Thank you.
mhm,
As an
here I
African
am.
American man, I want to thank you. Yeah, because we don't have a lot of people trying to work with us, as well as just go ahead and support us and advocate for us. So I appreciate it. Um, does does that say exactly why you're coming on the show? Like, what brings you here? What do you want to share with us today?
Well, when you invited me, it was like, okay, I do want to talk about why it's important to talk about mental health. Mental health matters. And African men are suffering in silence, and no one is really talking about it as much as we should talk about it. I know we started a lot of the conversations as of 2020, but look at all these years that we have just kind of ignored this. And like you
Mhm.
said, being a strong advocate for our communities is very important, and requesting, services is important. So I want to kind of share a little bit about 2020. 2020 was a year of reckoning about so many things, but one central thing centered on police brutality toward Black men, which was sparked by the murder of George Floyd under a white officer's knee. 2020 also brought awareness regarding health disparities that exist in this country. Today, I want to highlight how both of these major problems are affecting African American men.
Wow. Um, yeah, I remember George Floyd. That was horrific.
Mhm,
Seemed like there were some major events that kind of like happened uh, that pretty much all together that kind of like created a powder cake in a sense,
mhm.
where it was just an explosion. I know with myself, I was during COVID locked in the house. I couldn't really get out, so I had to deal with a lot of my own issues. So I know mental health with me, it became really important to keep my sanity. So thank you for sharing that. Why do you feel like right now that, besides George Floyd, why are Black men not really safe or okay in the United States?
Well, thanks for asking that. That's a very important question. I want to kind of go through this poem that I found from Princeton Powell. He wrote the poem after a fatal shooting of Michael Brown in Missouri in
Mhm.
2014. and it highlights the emotional challenges African American men face on a daily basis. The poem goes as being a Black man in America means being my brother's keeper while keeping a distance from my brother because I don't trust him further than I can see him. It's believing the cops don't care about you. It's learning how not to doubt yourself because when you're born, everyone else already does. So it's all this you struggling with your African American brother. You struggling with the system that's supposed to protect you, and then you already have your internal struggles based on all these racial issues that exist in the country that you live in. And
Wow.
all this stuff is not like it just happened when you become an adult male. This been going on your entire life. The system has really affected African American men for so long since we've been here. And one of the things that I highlight that when African American men are suffering in silence because they've been struggling so long due to the systemic issues that we have in this country of targeting African American men, trying to make sure that they don't exist in the community, that they don't exist in the family,
Mhm.
removing them to create this structure that actually not only affects the Black man, but affects the African American woman, affects their offspring. So here you see a chain of event, a domino effect of why we're not moving forward, why we're not progressing as we need to as a community, because the system was broken so long ago and we never repaired it.
Yeah, it's never been addressed. Yeah, I
It's
totally
never been
agree.
addressed. It's never been addressed. And it was all systemic of why we need to remove the African American man out of the community, out of the home. If you want to support as an African American woman, if you want to support, you had to not have the African American man within your household. There was a
Yeah.
reason for
Yeah, that reminds me of the movie, Claudine, which
Mhm.
I think, a lot of, social workers, I think they kinda, like, have to view that movie and, kinda, like, do a report on it because I know when I had to look at it in school, it was shocking, it was truth telling, and I can kinda go ahead and connect the dots, growing up as, with the single mother. So, yeah, I definitely that movie resonated with me.
Resume.
Uh, and,
Mhm.
in our culture, specifically talking about us, we have a lot of beliefs about mental health. What's one of the beliefs, that we absolutely have wrong? Talking about us.
Yeah. That, it it doesn't affect us. It's not true. Just something wrong with Uncle John in the basement. Somebody must have given him some laced his drink or giving him some bad drugs, not
Uh-huh.
realizing that we're looking at extreme cases. We're talking about schizophrenia, we're talking about bipolar disorder. Let's talk about stuff that people don't talk about, depression and anxiety that's still affecting one's quality of life. So, according to the Very Well Health, March of 2022, Black men in the United States suffer worse health than any other racial group in America. Black men live 7 years less than men of other racial groups. Black men have a higher incidence and higher rate of death from oral cancer. People don't talk about that. Okay. Cigarettes. Black men
Wow.
have a much higher risk of developing HIV and AIDS in their lifetime. 44% of Black men are considered overweight. 37.5% are obese. Black men have a higher incidence of diabetes, hypertension, and prostate cancer. Black men have a higher rate of suicide. It's the third leading cause of death in the ages of 15 to 24. And
Wow.
homicide is the leading cause of death for younger Black males. The number one cause of death for Black males between the ages of 15 and 20 and 44, in
Mhm.
2017 was homicide. And Black men are about 2.5 times more likely to be killed by police over the life course than are white men. About 1 in every 1,000 Black men are likely to be killed by the police. The risk is as the highest between the ages of 20 to 35.
Yeah, that's my son. He falls in that statistics. Right now, he's not yet 35. He'll be 35 soon. With all of this that's going on, with all of the issues that we're having in our community, especially with Black men, it doesn't seem like everything is working in our favor. Like, what are some of the challenges that we face with getting the proper mental health that we deserve, and that we need to be supported by in our community?
Well, when we talk about mental health, African Americans are very shy from approaching this topic, as I stated, and
Mhm.
finding the resources. So just kind of share some more information regarding mental health. 2018 data from Mental Health America indicates that over 16% of the African American community suffers from some sort of mental illness, a figure that represents over 7 million people. At the same time, the Substance Abuse and Mental Health Services Administration reports that roughly 2 out of 9 African Americans struggle with serious mental illness, and that over 6.5 million had a co-occurring substance use disorder and mental illness, representing an increase of over 10% from the previous year. Based on what we have experienced since 2020, these numbers are expected to rise significantly. So if the research is now starting to come out from 2020, it's
Oh,
2026. And so Black men mental health is more complex than statistically or clinical diagnoses because of structural racism and Black
mhm.
men unique history in the United States. Their mental health and treatment are intimately tied to factors such as implicit bias on the part of medical providers, high poverty rates, and low access to quality psychological and psychiatric services. So, just kind of the lack of resources in the
Yeah.
Black community, lack of health insurance, and which is
Oh
about to
my.
change. Something's coming down the pipeline for in May that's going to affect people health coverage, inability to afford proper care, and lack of education in the community about mental health. These are some of the reasons why African Americans, especially African American men, are not able to find the proper resources.
My
Mm,
goodness.
yeah. And
Yeah.
unfortunately, disparities in access to care and treatment for African American people have persisted over time. This is not something new.
It's something that's been around that we've been facing for quite a while.
Yeah, and taking the stigma out of it. The like
Mhm.
people that are battling with mild depression, mild to moderate depression, anxiety, would just people just say, you must be crazy. That term crazy in their
Mhm.
social circles, family, or having lack of faith in God. Let's throw the religious piece in there. The reason why you're depressed, the reason why you're anxious, because you don't believe in God. And that is so far from the truth. That's not true at all. So
Imma leave that one
mental
alone.
yeah, Imma go back to that. God wants you to get the help that you need, and I tell people that God wants you to get the help. He has given people the skills, the talent to help others. Use that. Just like you go to the doctor for any other physical ailments, hey, your mental health is just as important, sometimes more important. The one thing that share I
Woo.
worked 10 years with individuals who suffer from end-stage renal disease. And the one
Mhm.
thing I noticed about this population, nobody wakes up and say, I want my kidneys to fail. So here
Mhm.
you at a crossroad of your life and you have to make a decision, a quick decision. Do you want to be around here or not? And that starts up here. So I've seen
Mhm.
people who have come in on a gurney. I mean, they look like, okay, they're not going to be here long. But mentally, they're telling themselves, I want to stay around here. I know this is going to be hard, but I'm not ready to check out. And part of that process, them believing that, I've seen them go from a gurney to a wheelchair to a walker to coming in independently. I've seen
Mhm.
individuals much younger than them who really could not accept what was going on and make different life choices, and just angry with God, angry with life. And I've seen them come in walking independently into a dialysis facility. And as time went on, they're the ones who die fast because mentally they have not dealt with what was going on up here. So the mind will sacrifice the body. That's what people don't realize. I tell people that the mind will sacrifice the body to preserve itself. So if you're dealing with depression and anxiety, you can start having a lot of health conditions because you did not address your mental health. You will have a lot of physical ailments because you did not address your mental health.
My goodness.
Mhm.
What you just said is so impactful and so important. It reminds me of a poem that I had read. What was it? Mind is the master power that molds and makes, and man is mine and evermore he takes, the tool of thought and shaping what he wills, bring forth 1,000 joys or 1,000 ills. What
Mm.
man thinks in secret, it shall come to pass, for his environment is but his looking glass. I definitely think that that pretty much kind of sums up what you were saying. Like that mental state, that mind is going to affect the body, and then you'll see the outcome physically.
Yeah, you're
Wow.
going to see it. So let's kind of go back to spirituality.
Mhm.
Mental health education is important with helping the African American community understanding that it's okay to pray. It's okay to read your Bible. I mean, it's also okay to seek professional help and not suffer in silence. And that is one point when I hear churches really addressing mental health, I'm clapping because everybody needs to hear that within the community.
Yeah.
African Americans, we still go to church, we still
Yes.
listen to what the preacher has to say. So if the church can start promoting this, bringing in speakers and really say it's okay, I really think that will open the door to give people permission, if they can't give themselves permission, to seek the help that they need.
My goodness, man. Thank you so much. Thank you for joining us today. You have given us a wealth of information. And you know, as we started the podcast, I think you've tackled some of the ways that we can go ahead and start moving forward. So I appreciate that. But before you end, can you share just a few resources out there with our listeners, maybe websites or phone numbers that they can call to try and get started on getting their mental health together?
Mm. Well, it's two more points before I get to the resources that I want to
All
talk.
right.
And the last 2 points is the distrust in medical providers among Black communities, not trusting that people are going to do you right. So a lot of people don't seek mental health as well as physical health because they don't trust the medical profession. So I always, when I talk to my young people, they say, well, I didn't connect with that person. I said, you don't connect with everybody as a friend, do you? And they was like, no. I said, well, that's the same thing with providers. If you don't connect with that provider, does not mean that provider does not exist. That means be intentional of finding a provider that you connect with, that you can be honest with about what you're experiencing. Finding that
Mhm.
safe space. I'm always encouraging everyone, it's okay to go see someone. You want to find someone you want to connect with and find a safe space that you can talk about the good, bad, and ugly. Don't feel like you have to carry all these burdens alone and cause yourself more harm than good. And the other thing is the Black masculinity. Hmm. Ironically, Black men are more likely than white men to endorse aspects of traditional masculine ideology, such as the need to act tough and in control and to avoid emotional experiences. Dr. Richard Majors and Dr. Janet Bilson argue that poor urban Black men sometimes assume a stance of aloof swagger to defend against the harsh realities and racisms they encounter in daily life, which wears away at their physical and mental health. You're trying to keep up this facade. You trying to wear this daily mask that's no longer serving you well. Guess what? And you don't know how to get off of that train. You're afraid to
Mm.
get off that train. So as your mental health decline, you start doing things that cause you more harm than good. You might start, hanging out with the wrong group, exposing yourself to being killed by the police. You might find yourself starting to use drugs or, like I said, poor health care. You probably not having motivation to move forward, and
Mm.
how things are being promoted with marijuana use. That's where it's being promoted the most in the African American community. Guess what? Cigarette smoking is promoted the most in the African American community. Guess what? Alcohol use is being promoted the most. Hmm. African American communities. Heck,
Yeah.
that's another way to keep what? The system systemically affecting our people and keeping us at a low performing level,
Uh-huh.
a
Yeah.
low performing level.
It
And who
sounds
does
like
that affect? That affect African American women as well, and it affects
yes.
their offsprings, and no one's moving forward. So I'm a strong believer. If we can start working on getting better health care and better resources for African American men, then we can start changing the trajectory of the African American community.
Get the real help we actually need instead of trying to self-medicate, because it seems like we do a lot of
Not
self-medicating.
self-medicating. Yes, self-medicating. So now a podcast that I listened to recently, one of the churches here in Chicago was talking about marijuana use. And I
Mhm.
liked the approach that he was taking because he was just saying, give yourself a break. Let's see how you function,
Mm.
after 6 to 8 weeks not using. If you saying you're not addicted, this should be easy, right? And
Yeah.
so how some of the young people said they took on that challenge and they realized that their thoughts were clear, their moods were had improved, and now they can set attainable goals.
Yeah.
Before the goals was just floating up in the head, up in the air, going nowhere. And these
Yeah.
were very talented young women and men, very talented,
Wow.
but got caught up with, like you said, self-medicating.
Yeah, definitely self-medicating in it. I really don't want to like bring down a lot of our entertainment that we enjoy,
Mhm.
whatever it is, musical or visual. Right. It seems like we do promote a lot of self-medicating. Like I said, I'm not going to get into specifics about that, but I definitely agree. I do see that a lot. And it
Yeah.
seems like, please forgive the term, monkey see, monkey do is what my mama used to always say. So, she was
Yes.
like,
Yeah.
"Hey, just because you see somebody doing it don't mean you have to."
Well, it's that
Thank you.
sense of belonging. Remember, just feeling like I'm going to be left out. I'm missing out on something. I want this support group. So if I want this support group, do I need to do exactly what they're doing to be part of the group?
Mm. So what are some of the resources out there that can help us, especially I know probably a few people wanna go ahead and get started. What could they go ahead and do to go ahead and get that process going?
Mhm. One platform you can find someone is Psychology Today,
Mhm.
psychologytoday.com. And the one thing about Psychology Today, most of the providers have a photo so you can know if that person is African American or not. And
Yeah.
you can look over their credentials and they actually verify the information. So that's a quick way and you can uh, email that person, you can call that individual, you can ask for a consultation. So that's a quick way and easy to access. Um,
Mm.
Another platform is dealing with suicide prevention. And the number that you can reach is 800-273-8255, and they'll direct you to individuals you can talk to.
Mm.
Another for suicide and counseling services is called the American Foundation for Suicide Prevention. That number is 888-333-2377. And it's one directly. So creating emotional safe space. There is a lot of groups. Um, It's called Safe Black Space.
Hmm.
And then
Wow.
Therapy for Black Men. You can look up those two websites, Safe Black Space, and the other one is Therapy for Black Men. And they will have resources as well.
My goodness. Thank you for sharing some of those resources. I
And
hope that everyone was able to get it. What were you
one,
saying?
one last resource. You can
Oh, go
also
ahead.
Partnerships in Behavioral Health. We're located in Chicago, and you can
Uh,
reach us at 312-730-3966. 312-730-3966.
yeah. So all my Chicago listeners, definitely go ahead and reach out to them. If you have a family member, if that's not you, definitely provide that information. So to the Unpack family, I want to thank you for joining us. Dr. Latreece, I want to thank you also for coming on the show. This has been Unpack, where we unpack what hurts so we can heal what's hidden. If this episode spoke to you, I want you to go ahead and share it with someone who needs to hear this, because healing doesn't happen in silence. It happens when we speak. So I'm MTS. Thank you for joining. Please like, please share, please subscribe. Peace.